Imagine this for a moment. You're home alone. The TV is on. Or maybe you're reading quietly. Then, without warning, your chest tightens. A heavy pressure spreads across your chest. Your left arm starts to tingle, then goes numb. Your breathing becomes shallow and panicked. You're having a heart attack, and there's no one else in the house. This exact situation happens to hundreds of thousands of seniors every year. In fact, over 380,000 Americans experience a heart attack while completely alone, with no immediate help. But here's the part most people never hear. A major study published in the European Heart Journal found that people who knew exactly what to do in the first 60 seconds increased their survival chances by over 70%. Not medications. Not luck. Knowledge. Yet nearly 9 out of 10 adults over 60 have no idea what to do when a heart attack starts while they're alone. They panic. They freeze. Or worse, they make decisions that actually reduce their chance of survival. Today, I'm going to walk you through 7 evidence-based actions that could keep you alive long enough for help to arrive. These are not myths. They are not internet tricks. They are strategies supported by cardiologists, emergency physicians, and real-world survival data. And stay with me until the end, because the number one action gives a survival advantage nearly equal to having a paramedic already in your home. Before we begin, tell us in the comments. How old are you, and where are you watching from? We read and reply to as many comments as possible. Now let's begin. Tip number 7. Create your emergency communication system. This may sound simple, but when a heart attack begins, simple things suddenly become very hard. Within 15 to 30 seconds, reduced oxygen to the brain can cause confusion, poor coordination, memory gaps, difficulty speaking. In one study of heart attack survivors over 60, more than half couldn't remember their own address when calling for help. So preparation must happen before an emergency, not during one. Here's what to do today. Write your full home address clearly on a bright card. Include apartment number, gate codes, or entry instructions. Tape it next to every phone in your home. Program emergency services into speed dial on every phone. Yes, even though you know the number. When your hands are shaking, one button matters. Keep your phone charged and within arm's reach, especially at night. Many fatal heart attacks happen while people are asleep, when phones are charging in another room. If you live alone, use a medical alert device and wear it all the time, even in the shower. Many people own them, but aren't wearing them when they need them most. Tell at least one neighbor or building staff member about your condition if you have heart risks. Give someone a spare key if possible. Minutes matter more than privacy in an emergency. This system doesn't save your life by itself, but it removes delay, and delay is what kills. Now let's talk about something that can buy you critical time. Tip number 6. Cough CPR, when and how it actually helps. You may have heard of something called cough CPR. It's often misunderstood and misused. But when applied correctly, in the right moment, it can help you stay conscious longer. Cough CPR works by creating pressure inside your chest that helps move blood to your brain when your heart rhythm becomes unstable. In controlled medical settings, patients trained in this technique were able to remain conscious longer during dangerous rhythm disturbances. Here's how to do it properly, and this part is critical. At the very first signs of trouble, while you are still awake, take a deep breath, filling your lungs completely. Cough hard and deep from your chest. Repeat every 2 seconds. Deep breath, hard cough, repeat. The cough must come from deep inside your chest, not your throat. Each breath brings in oxygen. Each cough helps push blood forward. However, and this is important, this is not a cure. It does not replace calling emergency services, and it only helps briefly in very specific situations. Use it only while waiting for help, never instead of calling for help. Knowing this technique before you need it matters. You won't have time to look it up. And next, we need to talk about a mistake millions of people make with a very common medication. Tip number 5. The aspirin protocol most people get wrong. Almost everyone has heard this advice. Take aspirin during a heart attack. But what most people don't know is that how you take aspirin can determine how fast it works, and speed matters more than dose. When a heart attack begins, it's usually because a blood clot is blocking a coronary artery. Aspirin doesn't remove the clot, but it prevents it from growing, giving blood a chance to squeeze past. Large-scale studies show that taking aspirin early can reduce death risks significantly. But here's the key detail most people miss. Backhand index pointing right, you must chew it. Chewing aspirin allows it to be absorbed directly through the tissues in your mouth, instead of waiting for digestion in the stomach. Chewed aspirin reaches the bloodstream much faster than a swallowed tablet. When heart muscle is starved of oxygen, minutes can mean permanent damage or survival. Correct emergency dose: 325 milligrams total. Either 1 regular strength aspirin or 4 baby aspirins. Chew it completely, even if it tastes unpleasant. Keep non-coated aspirin in multiple places: bedroom, kitchen, living room, wallet, or purse. Check expiration dates twice a year. Important note: if you're allergic to aspirin, do not take it. And if you're on prescription blood thinners, your doctor should already have given you emergency instructions. Aspirin isn't magic, but used correctly, it can slow the damage. Now let's talk about something surprisingly powerful: your body position. Tip number 4. Assume the cardiac position. When people feel chest pain, many instinctively lie flat or pace around the room. Both can make things worse. Your body position during a heart attack directly affects blood flow, oxygen levels, strain on your heart. The safest position in most cases is called the semi-reclined position. Here's what to do. Sit upright at about a 45-degree angle. Support your back with pillows, a couch, or a wall. Keep your knees bent and feet flat on the floor. This position reduces pressure on the heart, improves breathing, helps prevent fluid buildup in the lungs. If you begin to feel faint or dizzy, lower yourself carefully to the ground. Do not collapse suddenly. Once on the floor, turn onto your side, not your back. This helps keep the airway open if you lose consciousness. Loosen anything tight: belts, collars, bras, neckwear. Even small restrictions can affect breathing when your heart is struggling. Also keep the room cool, not cold. Overheating increases the heart's workload. This position doesn't stop a heart attack, but it can buy you time. Now let's talk about something that directly affects how much oxygen reaches your heart and brain. Tip number 3. Controlled breathing that protects the heart. During a heart attack, panic causes rapid, shallow breathing. This feels natural, but it's dangerous. Hyperventilation lowers oxygen efficiency, increases heart workload, worsens chest pain. Studies show that people who control their breathing during cardiac events experience less heart muscle damage. Here's the breathing method you need to know before an emergency. It's called paced diaphragmatic breathing. How to do it: breathe in through your nose for 4 seconds. Hold for 4 seconds. Exhale slowly through pursed lips for 6 seconds. The long exhale is critical. It activates the calming branch of your nervous system and reduces oxygen demand on the heart. Place one hand on your chest and one on your belly. Your belly should move more than your chest. If possible, count out loud. It helps maintain rhythm and lets emergency dispatchers know you're still conscious. This breathing slows heart rate, lowers blood pressure, improves oxygen delivery, reduces panic-driven damage. Practicing this technique when you're healthy dramatically increases your ability to use it during an emergency. Now we move to a step that almost no one thinks about, but which costs lives every year. Tip number 2. The emergency door and signal protocol. This next step may sound simple, but it addresses one of the most overlooked risks when someone experiences a cardiac emergency alone. Emergency teams arriving, but not being able to reach you in time. Studies analyzing thousands of emergency calls show that locked doors and delayed access are one of the most common reasons care is slowed in home emergencies. Here's the critical rule. Backhand index pointing right at the very first sign of symptoms. Unlock your door first. Do this before sitting down, before calling anyone, before symptoms intensify, while you still have coordination and strength. Unlock your front door. Leave it slightly open if possible. This single action can save several minutes, and minutes matter. If you live in an apartment or building, call emergency services. Then immediately call the front desk or building security. These extra steps help responders reach you faster. Additional smart precautions. Turn on lights in your home. Keep a visible emergency information sheet inside the front door. Include medications, allergies, and health conditions. If possible, install a lockbox or smart lock and register it with local emergency services. This allows responders to enter without delay. Even small actions like visibility, access, and signaling can dramatically change response time. Now we come to the most important step, the one that research consistently shows has the greatest impact when used correctly. Tip number 1. The immediate nitroglycerin protocol. This final tip is powerful, but only applies to people who have been prescribed nitroglycerin by their healthcare provider. Nitroglycerin works by relaxing blood vessels, reducing strain on the heart, improving blood flow through narrowed arteries. When used early and correctly, studies show outcomes comparable to having immediate professional assistance on site. Here's the correct way to use it. At the first sign of concerning symptoms, sit down immediately. Never take nitroglycerin while standing. Place 1 tablet under your tongue, not on top, and do not swallow. Let it dissolve completely. This usually takes 20 to 30 seconds. A mild tingling or warmth sensation is common and expected. Set a 5-minute timer. If symptoms do not improve, take a second tablet after 5 minutes. Wait another 5 minutes. If needed, take a third tablet. Warning: never exceed 3 tablets in 15 minutes. Important safety notes. Never combine nitroglycerin with erectile dysfunction medications. Always store it in its original glass bottle. Replace every 6 months. Keep it in multiple locations at home. If a tablet produces no sensation at all, it may no longer be effective. Many people carry nitroglycerin but hesitate to use it or use it incorrectly. Knowing the proper protocol before an emergency makes all the difference. Final thoughts. These 7 techniques are not meant to replace professional care. They are meant to support your body during the critical minutes while help is on the way. Preparation matters. Practice calm breathing. Check supplies regularly. Make emergency access easy. Being informed doesn't create fear. It creates confidence. If you found this video helpful, consider sharing it with someone who lives alone or cares for an older loved one. And tell us in the comments, have you ever faced a medical emergency alone or supported someone who has? Your experience may help someone else feel more prepared. Thank you for watching.